Alright guys, so I'm going to show you what is the proper protocol to do for a male who has his hemipenes prolapsed. I'm going to repeat this throughout the whole thing. It is not for females. No matter what prolapse is, whether it's a hemipene bulge that's prolapsed, one or both, or a female, it is should be very serious, and you want to probably get vet help pretty quickly. But I'm going to run through the steps that we do here. And it's a very short timeline, before we have to get him to a vet. What we have here is a Tremper, high contrast. It's the first year we bred him. He does have a prolapse. We just had this notice today. So I'm going to take you through what we do. There's a couple reasons these can happen. Generally on first year males, probably 11 years I've been doing this, I might have had a prolapse 4 or 5 times, many males. A lot of times it's because they either A, have a substrate or a substance, which here in the hemipene bulges you can use your imagination what that substance is, that's making them stick out. We do not use substrate in our cages as paper towels, so I can tell you right now it's not a piece of wood or anything like that. So first off, what we're going to do is we're going to have a very damp paper towel for him. Clean cage, ready to go. He's going to not have his hide. He's going to have a clean water dish ready to go. Now you can see they are stuck out. What we're going to do for him now, you could use a sprayer, or of course they're not going to care for this. It's this is a sensitive area. We're going to make it damp for him. At this point, all we're doing is gently massage. See how it comes right off? You could use a Q-tip is what I strongly suggest for this. We've been doing this a long time. See that? What that is sperm plugs. People who breed snakes are very familiar with that. I don't know if it's coming up on the video or not, but that's what that is. He had 2 sperm plugs that were at the tip of his hemipene bulges that he was trying to get out. So at this point, make sure he doesn't have anything else hard and crusted on here. Again, you got to be very slow and careful about this. I do not see any more. That was most likely his problem, but I don't know that for 10,000%. So what we're going to do, you can see how nice and pink they still look. There's still blood flow. These are still viable. So at this point, we're going to put him back in on his nice wet towel. We're going to put him back in his rack system. What do we do from here? From here, we're going to come back in here early tomorrow. It's going to be the first animal we check. We're going to see if the swelling has gone down and he's able to get them back into the pouches that they have near the vent there. If that does not work, he's going to go see medical attention tomorrow. A prolapse is not something to mess around with. They can generally, it's a spot for infection, which is why you make sure you have a clean cage you're putting them into after you go ahead and clean the debris off. Don't ever use medications on it. Don't ever use Neosporin, triple antibiotic solution or ointment, because what's going to happen is they're going to pull that back in, and that could be even more of an issue. They could have abscesses. The best thing to use is just plain spray water, or sugar water you can also use. It's a very common method. But I can't stress enough that if these animals do not get better in a 24-hour period, they need to go see a vet for vet care, because there could be other underlying issues. I suspect with this male we got very lucky. It was just a sperm plug, which is generally what we see here. Of the 4 or 5 I've seen, every single one of them has been that way. And once you remove this sperm plug, like I said, gently with your fingertips. If it's the first time you do it, I do not recommend using your hands. Use a damp Q-tip. And that's generally overnight. They're going to be fine. Tomorrow they'll come back in and they'll be sucked back into the proper spots. Now, the other question is, will this male breed again? He is not going to breed anymore this season. He's done. But does that mean he will never be a good breeder in the future? No, it doesn't. It was his first time breeding ever in his life. He was a little overzealous. It doesn't mean that he's going to be a bad breeder forever. We have had animals where we bred them the next year that have prolapsed the year before. We've never had an issue with them. So, reiterate once again, clean, very damp container they're going back into. dampen the area around the vent. If you could visibly see a sperm plug and or some other, maybe you're using substrate stuck to them, you're going to want to clean that off. If it is not better and back in by the next day, you need to get into the vet for an appointment. Now this is, if I would come in and that prolapse would be just bloody, look infected, then it's going right to the vet. I'm not messing around with it. By no means is this a video to do at-home vet care, to not go in to see your exotics vet. That is what they're for. That is an integral part to keeping your colony healthy. This is just a tidbit. What we do if we see a stuck sperm plug that's causing the hemipenes to not come back into the vent. So again, you're going to have to see it. If it's a female and it's prolapsed, we aren't doing this. We're not messing around with it, because it could be either A, the rectum has prolapsed out to the vent, or even worse, it could be something with the reproductive system that has come out. That's going right to a vet. We are not doing any care here other than making an appointment and going to see a qualified exotic vet. We have one that does our whole collection. It is an emergency. It's an emergency fee. If you want to keep the animals, you have to be ready to pay for the vet. No matter if you have a dog, cat, lizard, snake, doesn't matter. That's just, gold standard care. So, hope you got a little bit out of the video. Hope this helps you guys out in the long run. And we'll do some more little tidbits on reptile medical advice here later on. Let us know what you want to see.